Hello, my name is Yang. It's my pleasure to introduce you about our basement membrane biological surgical graft and the applications in pelvic extension surgeries. XLRAG biological surgical graft is actually manufactured from basement membrane from porcelain bladder. So what is basement membrane? It's a special tissue that exists in many organs, and it functions as a supporting tissue for daily metabolism. So it's very thin and it's very uniform and mechanically strong. It contains basically 95% of collagen, peptides, and natural growth factors. So what we just do, take the raw material from basement membrane and we process it with a decellularization. And we will have the scaffold with free cells from pig, and we use it as a single layer of basement membrane. We take multiple layers of basement membrane and we compress them in a technique, and we form a biological graft for treating different types of defects and reinforce the soft tissue. After we implant the basement membrane graft into the body, it will immediately create a regenerative microenvironment for functional tissue regeneration. After you put it in 1 week, you will see a rapid new vascularization, and after some weeks, and there will be more cells migrate and grow into the material, into the layers. And from 4 to 8 months, the graft will gradually degrade, and the new tissue will grow and replace the graft and become a functional structured new tissue to reinforce the defect or the soft tissue. And from our study in the publication, we can see we compare the basement membrane with the small intestinal submucosa, and the basement membrane can really help for the recovery of the defect. And you can see the shrinkage as seroma. It can actually cause from the cyst material. And for the mechanical property of the regenerative tissue, the basement membrane is always strong and higher than 32 Newton centimeter, which means it can definitely hold the pressure of the abdominal cavity. Also, many publications mention about the basement membrane that can be used in potential contaminated environment. It can control the formation of the bacterial biofilms. So it makes it a perfect material that can be used in the colorectal disease. So in China, a lot of surgeons, they use a basement membrane surgical graft for treating the patient during the reconstruction of the pelvic extension. And we use it for the pelvic isolation. So from the publication, we can see when we do the pelvic extension surgery, it always comes with a lot of complications. Sometimes it's very risky and kills patient. And from publication, there are usually more than 30% of the major complications. So in China, the surgeon use biological surgical graft to do the pelvic isolation to reduce the complications of the pelvic extension surgery. So after the pelvic extension surgery, the tumor has been removed, and there will be an empty hole in the pelvic, empty cavity. So the small bowel and intestine will fall down, and will easily cause adhesion. And the biological surgical graft, you can actually fix it around the edge of the mesentery, and also can fix it around the pubic ligament. So it will use it as a pocket to hold the small bowel to avoid falling down. Practically, you can actually fix the pelvic floor plane with 1 layer of biological surgical graft, and you can harvest the omentum flap and insert the omentum flap into the empty pelvis to fill the gap. Then there will be another layer of the biological surgical graft as isolation and to hold the intestine small bowel. So in this way, you can complete the pelvic isolation, and for the perineum closure, and we usually use the negative pressure sponge to help for the healing. So this is a typical way of the rehabilitation after surgery. So usually you will see the patient with a lot of collections in the pelvic. Because of the isolation, the infection can be controlled in the pelvic. It won't go up to the organs, to the abdominal cavity. So we can put on the sponge with a negative pressure, and along with the time, it will gradually recover. This is typical a large defect of the tissue. So the soft tissue will gradually grow, and you can see the granulation of the new tissue and blood supply, and gradually the wound is closed. So use the pelvic isolation, we can actually lower the complications and enhance the recovery and survival, because the pelvic isolation can actually maintain the organ at its original place. So the patient can eat and drink and take the nutrition as usual. And when there's inflammation or infection or collections happens, it's limited in the pelvic floor. It won't go up to the abdominal cavity, and also avoid from the organs. And also it reduces the risk of adhesive intestine or small bowel. Then it creates a protection for the organs for some possible post-surgery treatment. And this will also limit, in some cases, the recurrent malignancy to invade other organs as a barrier. And in such case, it will reduce the rate of the post-surgery perineal hernia. And we study the application of the reconstruction by using the biological surgical graft, and with 200 cases in Changchun Hospital, we collect data and we study the data. We can see the complications is actually going down. But comparing it with the literature, and we can see the major complications from the pelvic isolation and reconstruction using biological surgical graft. It can go down to lower than 20%. And within the complications, the infection goes down to 9%, and the fistula goes down to 4%. And most importantly, the obstruction of small bowel, it goes down to less than 10%. So this is very significant, and it can really help the patient to recover in a faster way. Except the pelvic isolation, the basement membrane can also be used in the abdominal wall reconstruction. So this is a case, and due to the tumor, a lot of the muscle from the abdominal wall and the soft tissue have been removed, and there's no muscle at all. And one layer of the basement membrane be used here to replace the muscle, to reconstruction the cavity and the soft tissue, the abdominal wall. So in this case, after the surgery, for 3 months and 12 months post-surgery, we can obviously see there's no hernia happens during the incision, and the soft tissue is definitely regenerated, and it's even grows thicker along with the time. And you can see it's actually functional, because the new tissue can actually hold the pressure of the whole cavity. And by using this way, we can use it to prevent the EAF. So the mesh is not only to protect the organ, it can also use it to release the tension. We usually recommend to use a very large piece of the graft in this case, and by suturing it with a tension reducing way, the pressure of the abdominal wall, it can be taken or balanced by the biological surgical graft. So it can actually help for the wound to close. So in this case, with the open abdominal, the basement membrane can actually protect the organ, and the sponge won't be able to adhesive to the small ball, for example. And along with the time, the basement membrane will also help for the tissue regeneration. So after 4 weeks, and you can actually to reconstruct the skin and the defect with the skin flapping, skin grafting, and also we can use a stamp grafting to close it. So with the basement membrane, you can actually work as protection and regeneration during the same time. In some cases, it can also use as a barrier for tumor invasion. So this is a patient. In the first surgery, we have removed a large piece of the wall, and we replace it with a basement membrane graft. And after 1 year, when the tumor recurrence, we will be able to see it, and the graft has been turned and replaced by the new tissue. And because of the new tissue, the tumor has been blocked outside of the bone wall cavity. So beside of these two applications, the basement membrane surgical graft can also use in many pelvic surgeries. We can use it for grafting and reinforce the artery. So in this case, this is from the left part. You see, this is the first wrapping case from the artery. We have the part of the artery without reinforcement of the material, which has been leaked after 9 days. So after this, we always reinforce the whole artery, and there's no leaking afterwards. And it can be also used for treating the peristoma hernia because it can perfectly reinforce the soft tissue, and also it can take the advantage from the anti-adhesive benefits of the material, and it can be also placed into the patient for the rectum prolapse. It can be fixed at the anterior of the rectum and posterior of the vagina. You can use it to actually hold the pressure of the prolapse, the organ, and reinforce it of the whole soft tissue. In another extraordinary case, we use it to wrap and reinforce the uterus. There's a lady who is pregnant, and at the 12 weeks of pregnancy, her uterus has an incomplete rupture. So it's a very dangerous case, and the surgeon used biological surgical graft to wrap the broken uterus and reinforce it. And after some weeks, at the 28 weeks, and the surgeon we opened it, and there's a safe delivery of the baby, and then we be able to see the very nice integration of the biological graft with the surrounding tissue. And remember, the uterus during the pregnancy is expanding all the time, so the soft tissue is both elastic and strong to hold the organ during all these weeks and keep the whole safety of the pregnancy. So this is a very extraordinary case. To summarize, you can actually use basement membrane biological graft as a tool for the reconstruction in a very advanced case, because it has a very nice biocompatibility from the basement material, and you can use it to apply in a crucial case like pelvic surgeries. I mean the pelvic isolation and abdominal wall reconstruction. So we offer you a tool to help patient, to treat patient, to bring benefits to patient recover faster and quicker. In China, we launched a project called Everest Project, and we do the training and education for hundreds of patients, of surgeons in China already. And surgeons, they come not only from China, but all over the world. We are welcome to everyone who interested about technique and the whole surgery to come to China. We organize the training. We together combine the lecture, cadaver course, hands-on, and also the live surgeries. So welcome to join us. Thank you.